Dorsal spondylosis. What no one tells you about that nagging back pain. Have you ever felt that stubborn back pain that just won't go away? Even after rest, massage, or painkillers, it might seem like muscle tension, poor posture, or just another exhausting day. But what if it's something deeper, silent, and progressive? Something like dorsal spondylosis? This condition is more common than you think, yet very few people know how to identify it. And worse, many live with it for years without even being diagnosed. Most believe constant upper back pain is just part of getting older. But that's a dangerous myth. In this video, you'll discover what dorsal spondylosis really is, why it happens, how to spot the symptoms, and most importantly, what you can start doing today to ease the pain and avoid more serious complications. If you've ever been told that back pain is just normal or part of aging, get ready to challenge that belief. The reward? More quality of life, more freedom of movement, without depending on medication all the time. Dorsal spondylosis is one of those conditions that creeps in slowly, without warning. At first, it's just a little back discomfort, nothing major. But over time, it grows. What started as a minor ache begins to affect your routine, your sleep, even your mood. So what exactly is spondylosis? Simply put, it's the degeneration of the discs and vertebrae in your thoracic spine, that part of your back between the neck and lower back. Over time, or due to poor posture, inactivity, or physical strain, those discs start to wear out. Think of them as the shock absorbers of your spine, slowly giving in. What's interesting is that people usually associate back pain with the lower back or neck. The thoracic region is often overlooked, but its symptoms can be sneakier. Stiffness, pain when taking a deep breath, tingling in the arms, or a constant sense of fatigue. That struggle to sit or stand upright for too long. It might have a name, dorsal spondylosis. Now, if this content is already helping you understand your pain, or maybe someone else's, let me ask a small favor. If it makes sense to you, go ahead and hit that like button, subscribe to the channel, and turn on notifications. It helps this video reach more people who need it and keeps me motivated to bring you real, valuable information straight to the point. Back to it. If left undiagnosed, this degeneration can progress to nerve compression and even limit your movements. That's why recognizing the early signs is key to reclaiming your quality of life. A lot of people only discover they have dorsal spondylosis by accident during imaging exams for something else. An MRI or CT scan are the go-to tools for diagnosis. Even a simple X-ray can reveal changes like bone spurs, commonly known as parrot's beak formations. But here's the good news. A diagnosis isn't a life sentence. Knowing you have dorsal spondylosis doesn't mean you'll live in pain forever. In fact, with the right approach, you can stay active, mobile, and even pain-free. So, what does treatment look like? It's a powerful combo. Consistent physical therapy, strengthening exercises for your back and core, posture correction, ergonomic adjustments, and lifestyle changes. Movement is the key. Staying still only makes it worse. In some cases, when the pain is severe, anti-inflammatories, painkillers, or even spinal injections might be used. But remember, the goal isn't just to silence the pain, but to treat the root cause. That's why a multidisciplinary approach works best. The orthopedic doctor looks at the structure, the physical therapist focuses on function, and a trainer or movement specialist guides safe exercises. When these professionals work together, the results are much stronger and more lasting. A quick real-life example. Imagine someone who spends hours hunched over a desk. Poor posture, no breaks. Eventually, they start to feel pain in their upper back, spreading to the shoulders. They get it checked out, turns out it's dorsal spondylosis. With the right guidance, they start doing stretches, build strength, and adjust their workspace ergonomics. The result? Less pain, more energy, more control over their body. The truth is, dorsal spondylosis may be silent, but it doesn't have to control your life. Information, prevention, and movement, that's your winning trio to get back to living well. And just a quick reminder, this video is for informational purposes only and doesn't replace medical advice. If you recognize these symptoms, please seek a professional. Your health deserves serious attention. Now tell me in the comments, had you ever heard of dorsal spondylosis before? Are you dealing with back pain right now? What have you been doing to find relief? Your story could help someone else today. And hey, if this video helped you in any way, don't forget to like, subscribe, and turn on notifications. That way, you keep learning with us and help others do the same.